Hello, I'm Sharon with Nurse Tim, and I'd like to thank you for joining us for our webinar, Next Gen Test Item Types, Explore and Develop Today, featuring Karen Sherrill. We will have technical assistance available at 866-861-2896, option 1, or help at nursetim.com. Handouts are available to download on the right side of your screen. Please note, handouts are for personal use only and are not to be distributed to others. We invite our listeners to drop us an email or give us a call with any questions. We also value your input as to desired topics for future webinars. ANCC disclosures. Conflict of interest. This educational activities planners and the presenter have indicated they have no bias or conflict of interest. Successful completion. Criteria for judging successful completion of the webinar are attendance at the entire activity and submission of a completed evaluation tool. NCPD. This workshop has been awarded 1 contact hour by NurseTim Incorporated. NurseTim Inc. is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. For more information, contact help at nursetim.com. Objectives. 1. Evaluate a variety of next-gen item styles and critique how they measure Layer 3 of the Clinical Judgment Measurement Model. 2. Identify each step needed in the development of a well-structured, case-based next-gen item set. 3. Examine shortcut techniques to build a full repository of next-gen items. Purpose. This webinar will explore a step-by-step process to building next-gen items. Shortcuts will be explored to facilitate the development of a repository of case-based and standalone items. Throughout this activity, the speaker may use a variety of real and varied resources from health education vendors. They are for illustrative purposes and are not to endorse any product. All images and references to the NCSBN Next Generation NCLEX are the property of the National Council State Boards of Nursing and provided for teaching purposes only. And now I am pleased to introduce our speaker. Karen Sherrill is an experienced nurse educator with over 20 years of teaching experience at Maricopa Community Colleges in Arizona. During her teaching tenure, she has been involved with multiple projects, including online education, informatics development, active teaching strategies, new grad transition to practice, and the integration of classroom lab and simulation technologies. She teaches third trimester nursing students in the classroom and simulation lab, along with facilitating student success courses throughout the curriculum. Karen's full bio is available on the nursetim.com team page. We are so thrilled to have you with us today, Karen.
Thanks, Sharon, for that very warm welcome. And I want to welcome everyone who's listening to the webinar today. Whether you are watching us live or whether you are listening via archive, we always appreciate when you take the time to expand your wealth of knowledge and build your tool belt and just really grow as a nurse educator. Today, the focus is on next-gen testing items, different types. We're going to talk about that process of how do I recognize and identify different styles of next-gen items? How do I write those for my students? How do I provide a process that's similar to what students are going to be experiencing when they take the next-gen exam? The most important thing I can emphasize today is that we need to remember that it is not about testing our students next gen. It is about teaching our students clinical judgment. If we don't change the way in which we teach our students, they are not going to be prepared for these items or any other items. So I encourage you to watch some of the other webinars that we have that are specific to how to teach students clinical judgment in the classroom, in the lab, in simulation, in clinical, so you can create those habits of learning and thinking before that student gets to the exam. So whatever information I'm providing today, I'm quite certain will be different information tomorrow when you're listening to this. One of the things I encourage all faculty to do is to bookmark the NextGen page on National Council of State Boards of Nursing website. If you go ahead and link to their website, just put in the search menu NextGen NCLEX. That will take you to a massive repository of information related to NextGen testing, how the test was developed, how the scoring process takes place. Everything is there in a variety of different resources. There are some videos, there's some audio blogs, there are some newsletters. What I'd love to do is get on their mailing list. So if they have one of their quarterly NextGen newsletters coming out, it comes directly to my inbox. I don't have to deal with going to their website and searching further for the information. So I encourage you to do the same. As soon as you get off this webinar, please go to that location, get yourself signed up so you have constant updates coming from National Council. This information is changing all the time. So you need to keep yourself abreast and current of the changes that are happening. So let's look at the different item style types that we have seen introduced by National Council. And the 5 main categories you're going to find on the left-hand column of this table right here: multiple choice, multiple response, drag and drop, drop down, and highlight items. On the right-hand side are examples of ways in which we have seen pilot items presented on different platforms in different venues by National Council. And as you can see, you might take something that looks like a multiple response item, but there's several different ways in which that item may be designed. There's different templates that are being used to create that item. So currently on the NCLEX exam, if we say multiple response, we're talking about a select all that apply item. We're very comfortable with those. They've been around for a while, and currently they have 5 to 6 answer choices, but with NextGen, those can have as many as 10 answer choices. That traditional select all that apply multiple response item on NextGen, like I said, it can be up to 10 choices. They're saying the minimum is going to be around 5, but know that multiple response can come in other formats as well. So the multiple response can be select N. Select N means that the student would have a specific number of items they'd want to select of the correct choices. A multiple response can be in grouping. So there's a couple of different sections where they're going to group together some answers, and students have to select the correct answers within that grouping. There's a matrix multiple response where the student's going to select all the correct answers in a particular row. So as you can see, multiple response is just not a one size fits all, but comes in several different formats, as do many of the other item styles as well. Standalone items that are posted at the bottom of this table are going to be items that are not a part of the 6-question case studies that students are going to be receiving. A standalone item is just a single item, but it measures multiple components of the clinical judgment measurement model layer 3. Those 2 types of standalone items, bow tie and trends, is what has been introduced to us so far. We're being told that these items are only going to be delivered to students after they've met the minimum number of test items possible. So they're going to receive case study items for the minimum number of test items. Then anything past that minimum is going to be standalone items. So what will the computer screen look like to a student? And this is a very rough drawing or example of what that computer screen is going to look like. But what we are going to see, and what we're being told, is that the left-hand side of the page is going to be an EHR with navigation. So a student will see a patient's record, and it will have tabs at the top that they can click through to get different types of information and data about that patient. It's important that our students click through all of those tabs, because that's the only way they're going to have enough information provided to them to safely answer the question, which is on the right-hand side of the page. So the question itself will be on the right-hand side. And again, it's going to be based upon information found in multiple tabs of the EHR that's on the left-hand side of the page. So let's look at the different style of items that you may see or your students may see on the NCLEX exam. The first one is a multiple choice, and this is called a matrix or a grid. You can recognize the matrix grid questions because it comes in a table format. And the fact that this is a multiple choice tells us that there is a single answer. Okay, multiple response tells us many answers. Multiple choice tells us a single answer. So in this particular example, we have 5 different actions the nurse could choose from. The student would see the EHR on the left-hand side of the page. They would see this test question on the right-hand side of the page. And there's going to be some sort of a stem to this question, such as identify which actions the nurse should take in the first 15 minutes, within the first 2 hours, or before the end of the shift. And the student would have to go through each of these actions in each row and select one of those 3 choices, whichever they feel is most appropriate for that particular patient, given the information that they've just read about in the EHR. When we start to get into the multiple response, the most common one we're already familiar with are SATA questions, select all that apply. SATA questions, like I said, it can be anywhere from 5 to 10 answer choices is what we're hearing right now. And a question recently came up at a session, could it be just one answer that is correct, or would it be more than one? So the response to that was, if it was just one answer, then it truly wouldn't be a multiple response question. It would be a multiple choice question. So National Council's not saying specifically one way or the other, but certainly what was insinuated by that statement from Dr. Dickinson was that it will not be one answer, it will be more than one answer. But could all of the SATA options be correct? That is a possibility. Now, these questions are going to be scored with what's called a plus-minus scoring rule. And that means that if I've got 10 answer choices, and 5 of those 10 are correct answer choices, that question will be worth 5 points. Okay, so the student can earn 1 point for each correct response. Now, the reason it's called a plus minus is because if a student chooses an incorrect answer, they will have a point taken away. So if I have 10 answer choices, 5 of them are correct, the student chooses 3 of the 5 correct answers, that would give them 3 points. But if they chose 4 answers, which are incorrect answers, that would subtract 4 points, giving them a score of 0. And the reason why I say 0 is because students cannot go below 0. There cannot be negative scores delivered. So they will get a point for each correct response. They will lose a point for each incorrect response. And that is the scoring that we're currently seeing used for SATA style questions. Now, there's another style of multiple response called a select N. And a select N item will have anywhere from 5 to 10 answer choices. But the question will tell you exactly how many answers are correct. So the question would say something like, select the 4 correct answers from the 10 that are listed. And in this case, the student can only pick 4. They cannot pick 5. The computer program software will not allow them to choose 5 answers. They can only choose 4. And this is a different type of scoring. This is actually a 0-1 scoring, which means either they get those 4 correct answers or they don't get those 4 correct answers. So either they get a point or they don't get a point. When we look at a multiple response grouping, and again, multiple response means more than one answer is correct, but this particular question is built upon a grouping of answers. So for example, in this table, we have comorbidities in the left column, and we have assessment findings in the right column. So a student would look at the comorbidities related to uncontrolled blood glucose, and they would select as many choices as they feel are correct with the options of 1, 2, 3, and 4, anorexia, increased urine output, hypertension, diarrhea. So they would select all that apply from those 4 choices. And again, this is the plus minus scoring for each group. So they will either gain a point or lose a point based upon their answer choices. Now they also have the ability to have a second set of questions or options related to a different comorbidity. So in this case, what's related to uncontrolled hypertension? The nurse would have to choose, or the student would have to choose among those 4 options, and they would do a select all that apply from those 4 choices for uncontrolled hypertension. A multiple response matrix item is more than one answer can be correct in a row. So in the example you've got in front of you, after the student has reviewed the electronic health record on that left-hand side of the page and has clicked through all the tabs, then they can answer a question such as this, where it will say, which findings are related to which medical conditions? Select all that apply in each row. So for a fever, for example, we know a fever can come with all 4 of those conditions. So a student would select all 4 options in this particular table or grid matrix. Knowing that for each one they correctly choose, they will get a point. For which each one that is not a correct answer, they would lose a point. Then they would go to pain. Is pain consistent finding in each of those 4 conditions? They would select or not select each of the options. And on it goes down the line. A drag and drop close item. So drag and drop means they're going to click a word or a sequence of words, and they're going to drag it across their screen, and they're going to drop it into the right location. And this one is a close item because it's a fill in the blank. You know, a close item references something where we're populating a sentence with a particular word, or we're populating a table or something with a particular word. So in this case, the student has the opportunity to get 1 point for each correct answer that they select. So the nurse knows that blank is the priority concern for the client. They then would go to the table options that they can drag and drop, select from the 6 choices in column A, and they would drag that word up to the location within the sentence. Then they would answer the next question. Blank is the most effective medical treatment option. They would then select from those choices in column B, and they would drag those options into the correct location. And on they'd go with this question. Now it's a 0-1 scoring. That means for each correct choice they make, they will get 1 point. This particular example would be then worth 3 points if they got all 3 A, B, and C correct. Drag and drop with rationale. Again, drag and drop, click, drag is what we're doing with these items. But what's different about the rationale questions is it has kind of a cause and effect answer. And with a cause and effect answer, the student must get both portions correct in order to earn the point. So a question says the nurse should question the prescribed dose of blank. If administered, the client would be at risk for developing blank. Okay, so I would choose the causes from the bottom, drag them up to the correct location, drop them in. I would choose the effects from the column, drag them up to the correct location, and drop them into place. And in order to get the point, I would have to answer both of these 2 components correctly. So drop down is a little different than a drag and drop. Drag and drop, we are selecting it and moving it to the correct location, whereas a drop down is a sentence format or a table format where I actually have drop down answers. And of course, on a PowerPoint slide, I don't have the technology to make that happen. So what I've got is your drop down menus listed down below the question. So as a student answers this first sentence, the nurse knows that blank is the priority concern for the client. They're going to click on the drop down one, and they're going to see it populated with the options in column drop down 1, a stroke, myocardial infarction, pulmonary embolism. And they're going to select one of those 3 choices to fill in the correct answer within that sentence. Then they're going to move on to the second drop down option. Okay, so these are also scored so that you have 1 point for each correct sentence. So this has 4 drop down options. This particular question would be worth 4 points. Drop down with rationale, similar to drag and drop with rationale. This is one where we have both X and Y must be correct in order to get the point. So the student must have the correct drop down 1 as well as the correct drop down 2. It's a cause and effect rationale. Why is it that the defibrillation is needed, but it's needed because of blank? So it's really a 2-part single question. Student has to know what they're going to do, but they also have to understand why they're doing it. This particular question would be worth 1 point because it's 1 sentence. A drop-down table, again, the student's going to open up a sequence of answer choices wherever there's a drop-down within the table. So this is an example of some medications. We've got dose, route frequency, drug class, side effects, indication. Student will click on that drop down. It will open up a menu of options, and they're going to select the correct one for each of these table choices. This would be scored so that each correct answer is going to give the student a point. So this would be worth 4 points because I have 4 drop down options. Highlight text is unique, a new way in which to do it. You know, we've had in the past, we've had hotspot questions, and this is somewhat similar to a hotspot, except we're actually highlighting. So the student's going to hover over with their mouse particular components of an EHR, and this would be a replication of the EHR that the student sees on the left-hand side of the page, and they hover over it, and they have an opportunity to click on several components of that EHR record. So this particular question would be asking something like which piece of information or which finding or which assessment is most concerning to the nurse. And the student would hover over various components, make their selection, click on it, and it would highlight within the text that they're seeing. So how is this one scored? This is back to the plus minus, which means if there is 1 correct selection to be highlighted, that's worth 1 point. But if a student also selected another component that's incorrect, they're going to get a score of 0. So it will not necessarily tell them how many pieces to select, but some may. But more importantly, the student has to recognize, okay, what do I need to highlight and what is not important information? They have to differentiate between what is important and what's not important. Highlight table, similar. I'm going to be hovering over these different components. I'm going to be clicking on them and they're going to highlight on my computer screen. Then I know that I've selected those. So again, this might be a question saying which information or which a finding within the vital sign record shows improvement in the client's status. And the student would have to hover over whatever component they feel is most important. They're going to click on that and that will highlight, and that is in fact the correct answer. Again, if they select areas that are incorrect, they're going to be losing points for those. So now we're getting to some of the single select items. So the ones I previously showed you are going to be a part of a 6-question case, but a bow tie is a standalone item, which means a student may get just this one item and not have it related to a sequence of 6 different items. A bow tie is still going to have the electronic health record showing on the left-hand side of the page. And the bow tie, which is actually a form of drag and drop, is going to be that question on the right-hand side. This is going to have the 0-1 scoring. There's 5 possible points. So a student would have to make all 5 correct choices for each of these boxes in order to get this correct. And they're going to choose from different columns that provide information. So for example, Column A on the left-hand side has to do with the assessment findings. Column B has to do with the medical diagnosis. Column C has to do with the corresponding lab results the nurse should anticipate. So the question will ask something like, select the assessment findings for the condition that the patient is greatest risk for, and what corresponding labs should the nurse anticipate. Drag them to the appropriate locations on the bow tie chart. So students would select, click, drag, drop, and come to the correct answer. Excuse me. A trend item is the second type of standalone item that a student may see. And trends simply means they're going to have lots of information, lots of data, lots of assessment finding, lots of trends of information that they're going to have to evaluate and scrutinize and look over and monitor and see and think about how it interrelates in order to answer the question. Once again, a trend item, since it's standalone, is not going to be occurring in their exam till after they've met the minimum number of items. So if the student shuts off at minimum number, they are not going to see a trend item. But if they have to continue in the exam to show their competency, then it's likely that they will get multiple ones of these, depending on how long they continue in that exam. So let's pause just a minute, and I want to give you an opportunity to ask a few questions. We've talked about a lot of different styles of next-gen items, and I want to take a few questions from the audience. If you go ahead and chat your questions in, just type them into the chat menu, and I'll go ahead and troubleshoot some of those questions. So one question, and I tell you, this is probably one I hear the most frequently, is when are we going to have the software to be able to deliver these types of exam items? And that is just a very common question that gets asked. Keep in mind that National Council really showing everybody the scoring process and the layout of these exam questions was one of the last things that they did in their process. They completely did a huge piloting process first and identified how are we going to score these items. Then they started to demonstrate to software engineers how it is you can design these in electronic products. So that process occurred right at the tail end of 2020. And so since that time, our exam writers, our software engineers have been working very diligently to help build these types of exam items. Know that if you're using a product which is commonly used in nursing education, then it's likely that that particular product is already underway and they're already working at designing these styles of items. If you're working with a product that's built within a learning management system, I see their process as being much more slow. And I think part of it is because so much of what they focus on is higher education, and they don't necessarily focus on nursing. And we know that these style of items are very specific to nursing and nursing education. So that's part of the reason why that process is rolling out a little more slowly from our learning management system testing software program. So talk to your representatives, find out the status of whatever product it is that you're using so that you can plan to go ahead as time moves forward. And the other piece I'd encourage you to do is there's no reason why we can't be teaching these style of items now. We don't have to wait for our students to be tested on them. We don't have to put our proctored points into this. We really should be teaching them how to take these items. So build out some of these questions on paper and use them as class activities. If you're doing 10 minutes of lecture on cardiovascular and then provide them with a next-gen style item that is focused in next-gen format that's on a piece of paper, and put them into small groups and have them work through a patient in a next-gen style item. It's going to expose your students to this format. They're going to get much more comfortable and competent. Then when it transitions to a computerized testing program, it's not going to be a big deal for them. They've already seen this style of item. So that's one thing that I would really encourage faculty to take a look at. Let's see, any other questions? I think that's everything for now. So let's go ahead and move forward. And what we're going to do next is we're going to build out a case. Like I said, the cases that NextGen is suggesting right now is going to be on the exam in April 1st of 2023. A case consists of 6 questions. Those 6 questions measure multiple components of the clinical judgment measurement model in that layer 3. And so we really need to be prepared to build some of these questions and teach our students and question our students in their ability to meet each of these different components. So do your students know how to recognize cues? And do your students know how to prioritize hypothesis? Let's teach them those processes now so they can build that skill set. So that clinical case of 6 questions will hit all those components of clinical judgment and assess those components within your students. And they're likely to get 3 of those clinical cases in a minimum exam. So minimum number of items, 3 cases. We're hearing National Council now saying they may get up to 5 cases, but those additional 2 cases are going to be practice questions or pilot items. They're going to run statistics on it. It's not going to count against the student. The problem is our students don't know which ones count against them and which ones don't. So they're going to be coming to you going, oh my gosh, my whole exam was NextGen. I can't believe it. You told me there was only going to be 3 and I got 5. Let them know that that's because 2 of those items are pilot items that they're gathering data with. So let's think about that process. How do we go about building these cases? And so we can provide these learning activities and these testing strategies for our students. Well, I like a scaffolding effect. And what we all know when we're building a house is that we have to have a very solid foundation to put that on. So that first step or that foundational piece of your case that you're writing has to be built upon the course and or unit competencies or objectives. The first thing you should look at is what are the expectations of this course? What is the level of students that are going to be taking this question? What is the concept that I want it to be about, or what is the exemplar that I want it to be about? Make sure you set up that structure first. What are the components I want to include in this clinical case? How do I want my students to respond so it correlates perfectly to my course curriculum? Once I have built that first floor and I have that foundation of objectives, excuse me, now I can move on to the second floor. And the second floor is the process of building the client. So to build the client, I need ideas. What are some ideas I have in order to build the client? Well, there's a lot of places we can get ideas for building clients. The first thing I would suggest you do is take some of your existing case studies that you're already using. I don't think there's a nursing faculty in the country that doesn't have a case study that they use in their classroom somewhere, at some time, at some point. Let's start with those and let's build them into a more extensive electronic health record, making that case really meaty. And then we can turn that into an NextGen items. I also want to think about textbook cases. If I go to my online resources for my textbook, I can often find some case studies within the instructor's resource guide, or I can find cases within the end of the chapter of my textbook. I can find some cases there, use those in order to build out this NextGen item. There's no reason why you have to start with a blank sheet of paper. Get some ideas and get some input from these cases that are already out there and available to you. I can also think about my personal experiences, and personal experiences I think of as things that have happened to myself, my family members, people that I know that I'm close to. So as I've written cases over the years, I can tell you I've written a clinical case and a NextGen question about my mom and the stroke she had 3 years ago. I have written cases about my dad and Parkinson's disease. Because I know those details of those cases very intimately, it makes for a very easy case to write. I want to think about clinical experiences, and this is a great opportunity for us to come up with ideas as well as we're building the cases. The best time to get these opportunities is after a clinical day with students. So if you are practicing still as a nurse, come up with ideas on patients that you're taking care of. If you have students in the clinical agencies, at the end of your clinical day, think it over. What are some really interesting cases I've seen today that would make some great learning opportunities and meet the outcomes of my course expectations? Sit down and write some next gen items related to that. Some faculty I've seen take their care maps or their concept maps or their clinical paperwork or whatever it is you have your students do and use those to build out cases. Many times they are saturated with lab results, with medication lists, with past medical histories, and they can create some real solid case studies that can be built for next gen items. Think about the patients you're taking care of in your simulation lab. Okay, are you using some sort of an electronic EHR system that has built-in cases? Has your program built their own simulation patients and you can use those patients? Lots of patient data there, lots of ways in which to build a next-gen item. And of course, we always want to try to write about that patient. You know, over the years in nursing, you can think about, oh yeah, remember that patient. Yeah, well, those make some great clinical cases as well, because they're all very much in the front of our mind. And we're continually over the years reminded of that day that we took care of that patient. And those can make some great cases as well. So what happens when we get to the third floor? Well, at the third floor of building our house is the point at which we're going to start to apply clinical judgment. And rather than making this difficult, let's make it easier. National Council has provided to us a list of detailed questions you can ask in order to retrieve particular pieces of information from your students. And these cue cards that they've provided to us, I think, make great STEM starters for next gen items. They are printed on National Council's site in the newsletter that they put out in winter of 19. You'll find the URL at the bottom of this PowerPoint slide. You can also go straight to National Council's website and retrieve it from there. Look for the quarterly newsletter. Winter of 19 is where these were published at. These are just screenshots of what's within that newsletter. But as you look at these cards, they are very valuable. So for example, analyze cues on that left-hand side, asking the question, what client conditions are consistent with the cues? Okay, well, gee, there's a stem of a next gen question. Now I can take that, I can build a grid matrix and I can turn that into a next gen question. Or I've got generate solutions. What is the desirable outcome? Okay, well, gee, let me turn that into a highlight item, or let me turn that into a select all that apply or a select n item. And I can have that student generating solutions based upon that question stem. So print these out. I love them. I have them hanging in my office. I give them out to students. I have them at my desk whenever I'm preparing material. They are great STEM starters. They are great simulation debriefing questions. There's a million different ways you can use them. And it really reinforces the components of the clinical judgment measurement model. Now, that very final step is putting on the roof. And we often think we have to go straight to writing the items, but if you don't do that foundational work first, then it's very difficult to get that roof in alignment. So start with that foundation we had built upon and then come to this point. So this is the point in the process where I'm going to decide, okay, what kind of next gen item do I intend to develop? What am I going to build? And I can choose from those options that we had talked about earlier. So let's walk through the process. I'm going to build the first floor. I'm going to start with my course outcomes, second semester students. I have a course outcome that says apply problem solving strategies while providing care for an adult experiencing fluid imbalance. So I know that my concept I'm focusing on is fluid and electrolyte, and my exemplar for this particular case is acute kidney injury. Now I need some ideas. Okay, what am I going to do? What am I going to write about? And what I've chosen to do is to go to my conceptual clinical cases book, and I'm opening up chapter 8, and I'm looking at my concept of hemostasis, and I'm selecting case number 2, and I'm going to go ahead and build a next gen item based on this information. So here's what my case study says to me. It says, Alfredo Hernandez is a 38-year-old male who lives in southern Texas. He and his family migrated to the United States from Guatemala a few years ago. They live together in a small house. His primary language is Spanish, but he has acquired the ability to understand and speak some English in 3 years here. Like his mother, father, sisters, and cousins, he has type 2 diabetes. His diabetes is poorly controlled, and he is now on insulin. He has hypertension, decreased vision. His feet are often cold and numb. His family brings him to the community hospital today because he's having a hard time breathing. As I look at this paragraph intro to the case, I need to start thinking about, okay, what chart pieces could I document based upon this information? So I'm going to give you a second. If you're listening live, I want you to type into the chat some of the different chart parts that you could use in this question. And if you are listening via archive, I want you to take out paper and pencil and jot down some of the different chart parts that I include. So let me give you a second to pause and do that. Just write down different parts of the chart that we could be building based upon this paragraph statement here. So I'm starting to see some of the chat come in, and I see history and physical, H&P, good. Vital signs, good. Glucose trends, perfect. A1C monitoring, excellent. What else do I have here? I've got some social service notes maybe, and that would work perfectly as well. Maybe I've got an assessment flow sheet that talks about his poor perfusion that he's having. Excellent. Good. So lots of ideas, lots of suggestions. So here's a few that I came up with. Certainly we can identify a banner page to our EHR that has all the patient demographics in it. I could add to it some allergies, the name of the doctor that's there at the clinic for him, his name, his age. I could put in there his BMI. That would also give me some descriptive information as to his type 2 diabetes and the control of that based upon his BMI. I could add a nurse's note that shares a lot of this information as he enters the clinic today. Past medical history is perfect. I could also throw in there some surgical history if that's appropriate to the patient. Think about glucose flow sheet. Great, you guys said that, as well as your lab, looking at your A1C. Excellent. MAR, let me include a MAR in that process so that I can list the medications that he's on. And that could help to tell us how poorly controlled the diabetes might be. Does he take one oral medication? Does he take multiple oral medications? Is he insulin dependent? Okay, so, oh, he is insulin dependent. I just reread the case myself. So absolutely, I want to include that within my MAR that has the information related to how much insulin he takes and how frequently he takes that. I could include trends in his vital signs. You know, he's got a history of hypertension. I could show those trends. What is his current vital sign reading? And I could show that information as well as his physical assessment. So now we're going to move on. Let's start to build that second floor. I've taken those chart parts that I choose to include in my next gen item, and I'm starting to build those into a template. I'm going to include here my name banner. I've got my nurse's note, and I've got my first set of admitting vital signs as my patient comes into the community hospital that day. So just taking that written narrative and putting that into an EHR format is the first step. And it's an easy one because I have information right there. So my nurse's note simply says, brought to the emergency department by family after experiencing difficulty breathing over the last 24 hours. Primary language is Spanish, interpreter requested. Very simple, to the point, but it provides the same information as what our students read in a paragraph format, but it puts it into an electronic health record. So now as I start thinking about that first item that I'm going to develop of my 6-question case study, the first one I want to address recognizing cues. So I want to pull out my cards and I want to think about what information is relevant or irrelevant. That might be an interesting question to write. Or what information is most important? Or what is of immediate concern? Any of those question stems work beautifully with NextGen. So what does that look like into a test question? Well, I first want to go ahead and recognize cues. I've decided to make this into a highlight item. And I'm going to add the question stem that says, after reviewing the client information, select the findings that are most concerning. And I can simply have the students highlight the section of this EHR where it shows me they're recognizing the cues, but they're able to highlight that information and demonstrate that they know what the cues are. Now, as I continue on my journey, my second question I'm going to provide has to do with analyzing cues, because I want to hit every one of those steps. And remember, we go back to that card that tells us a stem. I select one of those. And in this case, the stem I chose is, after reviewing the client information, determine if the cue is relevant or irrelevant to the admitting symptoms. And for each row, I should choose a single choice. So this is a multiple choice grid matrix question that's analyzing cues. I've listed the findings on the left-hand side of the table in the bottom right corner. And a student would simply select if the temperature is relevant or irrelevant to this patient's admission. Is this important or not important? How about the heart rate, respiratory rate, and on down the line? Now I need to go back and say, okay, now I've written my recognized cue question. I've written my analyzed cue question. Now I need to go to the next couple steps of the clinical judgment measurement model. And those are prioritize hypothesis and generate solutions. So as I look at that data from my EHR on the left-hand side, do I have enough information for a student to start prioritizing the hypothesis and start generating solutions? Okay, could I answer the questions, which explanations are most or least likely? Or could I generate solutions and ask, what are the desirable outcomes? Well, as I'm looking at this, there's probably still quite a few reasons why I might have the symptoms I have. And I probably don't have enough concrete information for students to make wise choices about prioritizing hypothesis and generating solutions. So what that tells me is that I need to add another page to my EHR. So what have I added? Well, you know what? I add another nurse's note. So now I have another note 10 minutes later that gives me a little bit more background information on the patient. He says that the patient tells me through the interpreter that the shortness of breath has been increasing over the last 2 to 3 days. It's worse over the last 24 hours. He's not able to lie flat when he sleeps. He can only breathe when sitting upright. His hands and feet are swollen, having difficulty putting his shoes on to come today, crackles, positive JVD, signs obviously of fluid volume excess. Also has a little bit of nursing intervention in there. The nurse elevated the head of the bed, placed the patient on 2 liters of oxygen. Now, recognizing that I could still have a lot of different hypotheses that go along with this, I need to think, okay, do I want to pinpoint a little bit more specifically the direction I want my students to take? Because remember, I identified my exemplar here as being a kidney problem and not a heart failure problem. So in order to support that kidney issue, I'm also going to give my students some labs. And this lab report shows I have an elevated creatinine level. So now I'm starting to think, okay, I think I have enough information now that my students can prioritize a hypothesis and they can start generating solutions about how they're going to care for this patient. So let's build those questions. For prioritizing hypothesis, this time I'm going to use a closed drop-down option. And the STEM starter I'm using is, after reviewing the client information, complete the sentence using the choices in the table. And the sentence says a client is experiencing blank as evidenced by blank. So this is allowing my student to prioritize hypothesis of 5 different conditions and recognizing what symptoms could tell us that that is the problem. Okay, so now let's move to the next step. Now I need to generate solutions. Same chart parts. I've got enough information. And this is going to be a select N, a multiple response select N on generating solutions. I'm going to ask the student, after reviewing the client information, select each solution that will achieve the desired outcome for this client. Select 6 answers. Okay, so 10 choices, 6 of them are correct. And I want my student to go through and highlight or select the correct answers based on the information that's in the electronic record. So now we need to move on to the next part, and I need to first look and see, okay, do I have enough information in my EHR to allow for taking action and evaluating outcomes? And look it over, think about it. Do I have enough information that my student can do that? Well, not really. So let me go ahead and give them some orders instead. I'm going to leave my nurse's notes there. I'm going to leave the information previously, but I'm going to add an additional tab. And this time I've got a list of doctor's orders. So I've got 4 different order options from my healthcare provider. And the question I'm going to ask my student using a grid matrix option, and this is going to be a single select or a multiple choice grid matrix. After reviewing the client information, determine the sequence that the nurse should perform each action. And for this one, each row should only get a single choice because this is a multiple choice grid matrix. It's not a multiple response grid matrix. So they can only select first, second, third, fourth for the 4 actions that they have available to them. And they have to put those in the correct sequential order. So not only is my student taking action, but they're also prioritizing the actions that they're taking. The last step that I want to include is the process of evaluating outcomes. And of course, evaluating outcomes lets the nurse determine whether or not the actions they took were sufficient. So my EHR gives me the support I need. It's ready to roll. I think I've got everything I need to create an item from that. So the STEM starter I want to use is, after reviewing the client information, select each finding that indicates the client's condition is improving. Okay, this is an extended multiple response, and know that this one is select all that apply. So at least 2 answers or more out of these 10 are going to be correct. And my student will go through and select any or all correct answers. So, wow, that's a lot of information. Let's pause for just a second. Let me check to see if there are any questions within the chat. Not seeing any come forward. So let's just go ahead and keep moving forward. So one of the things I want to show you in the last few minutes here is the ability to, what I call, learn how to work smarter, not harder. And I put that in quotes just because I said it just now, but feel free to use that. You know, I don't think that anybody has really claimed that statement, but go ahead and use it because it's a good one. We have to figure out how it is that we make things smarter and rather than working harder, because we could spend hours and days and months and years building these items. So let me show you some shortcuts. When I take this particular nurse's note that we just used on Alfredo, as you look this over, what other patients could this nursing note be used for? And go ahead and type it into the chat. So I'm seeing COPD, good. CHF, excellent. Anybody with asthma, great. COVID, yes, absolutely. So there's a lot of different things that I could use this nurse's note for. It doesn't have to be somebody who's experiencing fluid overload from renal failure. Okay, so keeping a whole list of nurses' notes on a separate Word doc somewhere that you can just reuse and copy and paste to build new items. Let's take another example. Okay, I've got a set of vital signs here. What kind of patient could we use this for? Well, we've got someone who's got a low-grade temp. Maybe they could have an underlying viral condition or a beginning phases of a infectious bacterial infection, maybe an anti-inflammatory condition. I've got someone a little tachycardic, a little tachypnic, obviously quite hypertensive. I've got a low SAT, and I've got a high glucose. So this could be a diabetic patient. This could be a patient with breathing problems. This could be a patient with anxiety or pain or significant stress. Just a multitude of patients that this flow sheet could be used with. I don't have to build a brand new one. I'll copy and paste and reuse this set of vital signs. How about these prescriptions for this patient? Well, they're pretty generic. That could be a lot of different patients that come rolling into the emergency room or that are on that med-surg unit. A lot of patients are going to have these same 4 prescribed orders. So let's use it for a variety of patients. How about my questions? Okay, this is one of the grid matrix that came out of that particular case I just built. Knowing that this information is very generic and in fact applies to 95% of the patients in an acute care setting, I could copy and paste this question and use it for more than one next gen item. Same with this one. These 4 particular orders, again, the order might change depending on the patient information that's given. So have that student make decisions based on the patient they've got in front of them, not based upon the way they answered this question previously. My drop-down options in this particular item, I've got 5 different conditions and I've got 5 different findings, and they all have something related to the other. So I could use this for 5 different item styles, 5 different exemplars or disease processes that I'm writing to. And what about this one? Same thing. I'm evaluating outcomes. This is a ton of patients we take care of with a whole variety of different concerns and issues. So again, this is going to be something that I'm going to reuse time and time again. So how else can I mix this up? I can also go through the process of not only changing my chart and my chart parts, but I can also change the question style. So for example, when I wrote my recognized cues question, I used a highlight, but I could also take that information and I could build out a grid matrix question. And then I could also take recognized cues and I could build out a closed dropdown. And I could also take recognized cues and I can build out an extended multiple response. So for this same patient here, I have 4 different options under recognized cues. This would give me a huge repository and question bank in provide it to our students, and so that I can rotate those questions every semester. Maybe I can use some for practice in the classroom. I can use some for piloting exams, and I can use some for actual exams that are going to work for proctored points. So lots of different ways to mix and match everything. So we are about out of time, and I apologize for that. But what I'd encourage you to do, if you have any questions about this presentation, please reach out to me, just ksherrill@nursetim.com, or you can also send a question to me through help@nursethink.com. Ask for Karen or tell them to forward it to Karen, and they'll make sure that I get that. So thanks so much for taking the time today, and I'll turn it back to you, Sharon, to talk about the evaluations and the contact hours.
Karen, thank you so much for presenting today. We really appreciate having you and all of your wealth of information that you've shared. And now I'd like to invite all of our listeners to fill out an evaluation for your NCPD contact hour and also share your valued feedback. Please click that evaluation link on the right side of your screen. And thank you to everyone for joining us today.